Afternoon. We're going to talk about testing. Testing is one of the keys to reopening the state, which is why we are working diligently to expand testing through public-private partnerships. I thank the governor for working tirelessly to bring the necessary equipment and supplies for testing here to Illinois. Testing leads to quick identification of cases, quick treatment for those people who are identified as positive, and immediate isolation of individuals that will help prevent spread. More readily available testing will also help us determine if close contacts to the confirmed cases have been infected. Testing is also important for the bigger public health picture so we can hone our mitigation efforts, do targeted interventions, and learn more about how the virus is spreading and to whom. Knowing who is infected is critically important, which is why we are asking everyone who is tested to make sure they fill out the information on the form completely. The form asks for important information such as age, gender, race, ethnicity, county of residence, occupation, the clinical history surrounding your situation, recovery and exposure information. Gathering this information helps inform our strategy, helps us to understand who is getting affected and in what areas of the state. It helps us to stop spread and provide support and assistance to communities that are identified as needing it most. People who can be tested includes anyone who has symptoms like fever or shortness of breath, chills, loss of taste, loss of smell, sore throat, but also without symptoms if you work in a healthcare facility, if you work in a nursing home, if you work in a correctional facility like a jail or a prison. Added to that are the first responders, whether paramedics, EMTs, firefighters, law enforcement, people who support our critical infrastructure, such as grocery store workers, people who work in pharmacies, restaurants, gas stations, public utilities, childcare, and sanitation workers. We also are including those who have underlying health conditions, and in the near future, as we start to think about elective surgery, those who are having elective surgery. Again, testing and comprehensive information will help us end this pandemic sooner. Regarding our numbers here in Illinois, we are reporting 2,563 new cases of COVID-19 here in Illinois, for a total of 52,918 cases. This includes, unfortunately, 2,355 lives lost here in Illinois, of which 141 were reported in the last 24 hours. To date, we have run a total of 269,867 tests for COVID-19, with 13,200 being performed in the last 24 hours. As of yesterday, 4,953 individuals in Illinois were reported to be in the hospital with COVID-19. Of those, 1,289 patients were in the ICU and 785 patients were on ventilators. As we further ramp up testing, we need to remember that we all must continue to stay home as much as we can, to wear masks and social distance if we do have to go out, and to wash our hands frequently. This will continue to work as we remain all in for Illinois.